they used a trigger of ITU occupancy. And when ITU occupancy became high, there were a lot of critical cases presenting to hospital, that would trigger lockdown. And when it became below a certain point, if you released the lockdown, then you'd get a second wave and then a third wave. And I'm afraid that this will be the scenario that we face. I do think currently, if you look at the people who are pressurizing the Conservative government, there was a large list of their own donors and business people who are very keen to try and get out of the financial crisis that they're in. The financial crisis, of course, is not simply caused by coronavirus alone, although that's clearly a contributing and precipitating cause. Really, what's underlying the financial crisis is overall levels of poverty, which are pandemic globally. And I'm afraid to say that when we come back from this, when we see the level of spending that our government have had in order to bail out large businesses, far less of it going directly to workers who are the most needy and most numerous section of the population, we'll find another burden of debt falling upon the taxpayer, which will drive yet more austerity measures. We're already seeing life expectancy beginning to falter and decrease amongst the poorest populations, particularly of northern women in Britain, prior to this pandemic, and I'm afraid to say that that is an economic condition which is underlying the situation. But do I think it's safe to release the lockdown at this point? I really don't, George. I really feel that the ideal situation would be to have the targeted measures, so widespread testing to allow us to know exactly where the virus is and deal with it in an intelligent manner. And in that way, you can have a structured release to the parts of the population who are least affected and still isolate the virus from the population. It's quite clear that that's not going to happen now. This promised 3.5 million tests has totally evaporated as far as I can see. We've not performed more than 550,000 tests. So a very small percentage of the overall population and still a very small percentage of frontline workers and health staff have been tested. So there doesn't seem to be a clear way out without incurring a second wave of cases and mortality on top of that very significant amount that we've already experienced.